But I'm glad to be here. Thanks for inviting me. My name is Len Bose, and I'm from Intermountain Healthcare. And I wanted to talk more specifically about the impact to us, what the meaningful use is, what we're kind of thinking about at Intermountain. And we all know what high-tech and ARA are, so I'm going to go through these. But we've got about $100 million on the table for Intermountain. Intermountain, just for a little background, we're a nonprofit IDN in Utah. We have 700 employed physicians, 23 hospitals, and we've had EHR since about 1970. We were one of the first ones to experiment with it, and it's really become part of our culture. But when I see this, and I was a physician and then came on in informatics, been at Intermountain for 13 years. This is the biggest project I've seen come down the pike. I'm sure you are thinking that as well, especially speaking as a physician and being over the implementation effort to get our electronic health record out to our physicians. You all know how difficult it is to do that, even with a really good electronic health record. So this is going to be a huge challenge to certify and then to implement or roll this out. As I mentioned, besides the incentives, we have the penalties that we're facing. And you guys have all seen the graphs. I'm going to go through those. But here are the gaps in Intermountain. It's actually pretty accurate. We have our own home-built electronic health record. And when we looked at the functional requirements, we still need to fill 26 of the 61. These are the ARRA certification requirements that CCHIT put out. So we have to fill 26 of 61 in functionality. We need to fill 19 of 29 in security and privacy. We are exchanging clinical data, but we have a ways to go. And then the quality measures is really daunting. We generate our quality data from a data warehouse, not from the electronic health record. So I think that might be similar to what you do. But the requirements right now require the quality measures to come right from the electronic health record, and we don't do that.